Welcome back. Now, Dr. Rukavina, you just got done telling us about the renal denervation study to control hypertension or blood pressure. But you're also doing a study to help with atrial fibrillation and one of the side effects of stroke with atrial fibrillation. Tell us what atrial fib is and why to do the study.
Yeah, the CAP trial is a study that is attempting to prevent strokes in patients with atrial fibrillation without using blood thinners. Atrial fibrillation is a very common arrhythmia in patients. By the time they get to be 70 or 80 years old, 10% of the population has atrial fibrillation, and we see it increasingly. It's almost endemic. So the reason patients with atrial fibrillation have strokes is that there's a stasis of blood up in the upper chambers of the heart, and in particular a structure called the left atrial appendage. And we think that over 90% of strokes are caused by blood clots forming in the left atrial appendage and then embolizing or circulating out into the body and up to the brain. So traditionally we have tried to prevent that thing by putting patients on blood thinners. But that really commits patients to blood thinners for the duration, for the rest of their life, in effect. And so we're trying to prevent that by actually sealing off the left atrial appendage with a device that can be implanted from a vein of the leg up to the heart and through that structure. And if we do that, we feel like we can prevent strokes and take patients off anticoagulation, off blood thinners.
And that's one less side effect. Blood thinner can create a whole bunch of problems.
Right. Blood thinners, even though there have been new blood thinners that have been introduced over the past several years, there are still risks of bleeding and so forth that we'd like to try to prevent.
Okay. Now, Dr. Jones, Baptist Hospital is one of the few hospitals that do these studies. I mean, not everybody does cardiac research.
No, that's true, and we're very happy and proud that we can offer this to our patients. In fact, of the studies that we're talking about, the Absorb trial, looking at the absorbable stent, we're one of 120 hospitals in North America that's part of this study. The renal denervation study, the Enlighten trial, we're one of only 80 hospitals in the United States to have this technology. So we're very pleased, proud, and happy to be able to offer this to our patients. And let me just say, too, I think we have, or will have soon, a phone number on the screen. If there are any patients who are interested in participating in these or other trials, or any physicians who would like to refer their patients to us for these trials, please call us. We'd be happy to see you. Doctors would be happy to see your patients.
Now, you're also doing another trial, and if I see if I can get this out, Lumen, is that what it's called?
Illumian, yes, Illumian. It's kind of like aluminum, but it's Illumian. This trial is really not a randomized trial like the others, but it's a registry. In other words, we're not using experimental techniques, but we're using two very new techniques that are approved by the FDA to try to improve patient outcomes. The first is OCT, or optical coherence tomography.
That's a big word.
But it is a big word. It is. And in fact, Baptist Hospital was one of the first adapters of this technology in the country. We had this technology for 3 years. And this allows us to look inside blood vessels of a beating heart in the catheterization laboratory and to, in fact, get high-definition images, both to measure pressure and to see what the blockage is made of. You know, blockage on a coronary angiogram in the cath lab is a shadow, but it's much more complicated than that. By looking at it with OCT, we can see whether it's fat, what kind of fat it is, we can see whether there's calcium, we can look at eccentricity, we can get a whole lot of information about the plaque that we don't get from an angiogram. The other technique we're using in the Illumium trial is fractional flow reserve, or FFR. This is a technique where we use a small guide wire that's placed across blockage in the coronary arteries to measure pressure gradients across the arteries. Now, both of these techniques are used every day in the cath labs now, and in general we use the FFR, the pressure measurement, to decide if the patient needs a stent, and the OCT to optimize stent placement when it's in there. But the Illumian trial, we're doing both of these procedures in order to see how these procedures complement each other to optimize results for our patients.
Well, that's great. It's great cardiac research. Gives our patients cutting-edge information. We thank you for coming in. We'll be right back.